So today we're going to be discussing the topic of multi-layered stigma. And this framework allows us to have a more in-depth and intersectional understanding of the ways that someone encounters and experiences stigma based on aspects of their identity, their life circumstances, and their lived and living experiences. So it's quite well known that the repercussions of stigma are quite grave. So we know that experiencing prejudice, stereotypes, discrimination, and judgment can lead to isolation and shame, and can also lead to negative physical, social, and mental outcomes. The multi-layered stigma approach allows us to have a more in-depth understanding of how someone experiences stigma. So multi-layered stigma refers to the ways that someone experiences various forms of social exclusion, judgment, and discrimination based on various aspects of their identity, life circumstances, and life choices. Now, through this model of multi-layered stigma, we expand beyond just thinking about the ways that someone experiences stigma from broader society. We also consider how someone can, at the same time, experience stigma within their own communities and cultures, and how that can really be a threat to their sense of belonging and identity. And when we're referring to communities and cultures, this really is a broad concept. So this could encompass religious communities that you belong to, mom groups that you're in, dad groups that you're in. Maybe if you're part of the Black community, it can really encompass many different aspects of a person's life and the communities and cultures that they identify as belonging to. So the way that the multi-layered stigma model works is that we consider the stigma that someone experiences relating to their identity, life circumstance, or life choice. So for example, having a mental illness. And then we would look at how someone experiences kind of an overarching stigma within society based on that aspect of identity or lived and living experience, but then also how other aspects of their identity influence how they experience stigma. So for example, someone with a mental illness who's also Black and disabled may experience stigma based on their ability, their race, as well as their mental health status. So we can begin to see how those layers start to pile up in how that person experiences stigma. Now, the other important piece of this model is the ways that that person may also experience stigma from within their own communities and cultures. So let's say that this person belong to a certain Black community. Maybe they're also experiencing stigma based on their mental illness within that community. Or maybe they belong to a disability justice movement community, and they're experiencing forms of judgment or stigma within those communities. So this allows us to see how with stigma, people can often feel like they don't have a sense of belonging within broader society, but they may also feel a lack of belonging within the communities and cultures that they exist within. And this can have a big impact on someone's sense of self and their well-being. So how can you use this model? This model can be applied to any stigma that someone may be experiencing. So some examples could be stigma related to substance use, physical and mental health diagnoses and conditions, life circumstances like intimate partner violence. And this model can really support you in understanding how the individuals and the communities you work with experience multi-layered stigma. And it allows you to have a more in-depth understanding of the ways that they encounter and experience stigma.